So, what does it actually mean to care for a child? Beyond the checkups and prescriptions. Today, we're going to dive into a really powerful way of looking at pediatric medicine inspired by Dr. Annie Zimmer of Boys Town. And believe me, it all hinges on one single transformative idea.
And there it is, that one word, privilege. Right away, that changes everything, doesn't it? This isn't just about having a job or providing a service. It's about seeing your role as a profound honor. And that one little shift in thinking, well, that's what we're going to unpack, because it completely changes the entire dynamic of care.
Okay, so what does that actually look like day to day? When a doctor sees their role not just as a duty, but as a genuine privilege. Let's take a closer look at how that single mindset can build a totally different, more compassionate, and way more connected approach to medicine. So, this idea of privilege completely reframes the whole doctor-patient relationship. It stops being just about medical charts and expertise. Instead, it becomes about earning a family's absolute trust. It's an honor, and as Dr. Zimmer says, it's a responsibility that she is totally committed to delivering on. It's like a personal promise, not just to the parents, but to the child, too.
But, what's the real reward for all this? If you're looking at your work through this lens of privilege and deep responsibility, what's the ultimate payoff? You might think it's all about cracking some complex medical case, right? Well, you might be surprised. It's actually something much more human.
I mean, think about it. In a field like medicine that's so demanding, so incredibly high stakes, what do you think the biggest reward is? Turns out, it's probably not what you'd expect. It has nothing to do with test results or reading charts. It's found in a simple but amazingly powerful human connection.
And there you have it. The real metric for success? A kid's smile. Seriously, when a child is actually excited to see their doctor, that's the proof. It's a clear sign that trust has been built, and that fear, well, that fear is gone. In the world of pediatrics, that is the ultimate win.
Okay, but this connection doesn't just stop with the child. Nope. It radiates outward, touching the entire family. And over time, it creates this incredible sense of community and shared experience that can last for years and years. It's all about creating what's called a family culture. And what that means is a doctor becomes way more than just a professional who shows up for appointments. They become this consistent, trusted figure who gets to witness the ups and downs of a family's whole journey. And this is where the real magic happens, right? It's a long-term thing. It starts with getting to know just one child, and then it expands to include the entire family unit. And so often, the whole beautiful cycle starts all over again when a new baby brother or sister comes along.
They're not my family, but they kinda are. Wow, just let that sink in for a second. That one sentence just perfectly captures this unique, really profound bond that forms when a doctor becomes such a trusted, essential part of a family's life over years of dedicated care.
So, what does all of this tell us, really? It kind of makes you wonder, maybe the most powerful medicine out there isn't something you can get in a bottle or a prescription. Maybe it's found in a relationship that feels, well, a lot like family. It's definitely something worth thinking about.